There are a lot of changes in the society. First of all, the quality and of the scientific level of the meetings has increased a lot, and also the participation, this disparity of the participation from the country-wise has changed a lot. Now we are receiving participants from all over the world, not only from Europe. For instance, last year we have done it in Istanbul, and in Istanbul we had some participants from Japan and China as well. Also, we started a new program in Istanbul, and it's continuing here. We want to have more lady cardiac surgeons and cardiovascular surgeons to be involved with the program. And we have done in Istanbul a ladies session of cardiac and vascular surgeons, and it was really very well received. And this year here in Belgrade, yesterday in executive committee meeting, we decided to have some members, women members, to both cardiac surgery site and vascular surgery site. These are really very important improvements. There is one more to say, which is about the international connections has increased. Last year, in Istanbul meeting, we started to have joint session with ESCVS, European Society of Vascular Surgery, and Japanese Society of Pediatric Cardiology and Cardiovascular Surgery, and also we started some connections with American Heart Association. And in this regard, this year in 2016, we will have reciprocal mutual sessions in American Heart Association meeting in United States. They invited us to arrange sessions. We will have 2 sessions there. And they have arranged last year one session in our Congress, and it will continue. The same applied to European Society of Vascular Surgery. We are having mutual reciprocal sessions in our congresses. So collaboration together with international societies has increased recently, which is quite new. I really see the future of our society very promising, because we are depending on not very old or senior cardiac surgeons and vascular surgeons. We are depending on serving and working with young people. So this is one important issue, one important point for the future of our society. The second important specification of our society is to have cardiac surgeons and vascular surgeons in our board together. So to have these two societies, two specialization together on board really enriches the program and brings a great strength to our society. So I can foresee the future of our society very promising. It's very successful. The participation looks very well. As I said at the beginning, the scientific program is really very high-level program. So I believe that this Congress itself will contribute for the future of ESCVS Congresses. If you look at my life, first issue is hardworking. So for new generation, it can be really a difficult recommendation to work hard and harder. I know what they think in general, but this is the key issue, at least what I know for the key of the success. But on the other hand, I would like to focus on one subject and to be scientific as much as they can from the starting point on. This is very important recommendation for young cardiac surgeons and vascular surgeons. Another issue is to communicate, to collaborate together with them as much as they can. Now they have better chance of communicating each other than our ages, but they have to use these tools, these multimedia tools, for their scientific communication as well. That can bring something totally new, insight for their success. Another recommendation can be they must be as innovative as they can. So innovation is the key issue, especially for the developing countries. So if you can, not developed countries, but developing countries as well, if you think about innovation and innovative as much as you can, they can at the end find some small improvements in their techniques, in their life, or in their career, and that might be very useful at the end all over. When I have done the first minimally invasive procedure, I just realized that I have started, my first publication regarding that is 1998. So it is the same ages that was started in same years that it was started in the United States. So we almost simultaneously started with United States with thoracoscopic surgery, thorax surgery, and I've done the first ligature of PDA in 1998. That was our publication. And by years, in those years, nobody was expert. We started all together. And I was very active in International Society of Minimally Invasive Cardiothoracic Surgery in those years. I was in the board of it, and we have done we have performed the winter workshop of International Society of Minimally Invasive Cardiothoracic Surgery in Turkey, and I was active step by step. It didn't come at once. So I started with thoracoscopic surgery and taking biopsies from the lung, and then sympathectomy, thoracal sympathectomy by thoracoscopy in those years. Then when it moved to cardiac surgery by Cosgrove, it was nothing new for me. I immediately started with as soon as I have seen it. But I didn't like the Cosgrove's technique at the beginning because it was causing a lot of trouble on right hand side, and then right thoracotomy. Then I thought for the first time upper mini sternotomy for myself, and at the same time simultaneously the other people in Europe used the same approach. So just a direct answer to your question, we improved our techniques by communicating each other, and we were pioneering those years. There were nobody really very expert to teach each other. We came together and improved our technique all together by years. For my opinion is the minimally invasive cardiac surgery it must be standard operation in many operations, in many cardiac operations. For instance, for aortic valve replacement, it is already a standard operation. I cannot think why should a person would open the whole chest, whole sternum for just 5 millimeters of aorta that can easily do with direct vision with standard armamentarium. But for mitral valve replacement, there are some direct vision techniques that I can use, but for repair you need endoscopy. So whenever you have endoscopic or thoracoscopic devices, you have to go with minimally invasive technique. It is essential, crucial to compete with catheter-based systems first, and also to serve to the patients in better way, because there is a tendency of not to open the sternum completely nowadays. So we cannot resist it. We have to obey the patient's expectation, and we have to we have to work with small incisions.